Good evening. For those of you who don't know me, I'm Carol Terregino. I'm the Interim Senior Associate Dean for Education. Students, faculty, and Robert Wood Johnson Medical School alumni colleagues, welcome to AMSA's Med Talks, Motivate, Educate, and Dream. I want to thank Stephanie and Andrew, I'm not sure where you are right now, for your leadership and organization of this program and for your invitation to participate. I'm really honored to open the program and to recognize this evening's speakers, fellow alum and faculty member Tom McPartland, fellow faculty member Dr. Anthony Tobia, and students Michael Serzan, Patrick McGovern, Melissa Villars, and Akanksha Arya. You're all really gutsy, and I really want to tip your hat to you. A TED Talk, 15 minutes, motivation, passion, and no paper. Look at me, I need notes to do an introduction, so you guys got a lot of guts. So I'm going to do a med talk, but I'm going to make it an elevator talk. It's 30 seconds to make an impact. I am passionate about educating medical students. I am grateful for the 4 years that they spend with us. I'm amazed at the humanity they bring, the depth of experience in research, public health, service, and the arts. And when they take the oath, I also take an oath to educate, but not just to educate them, but I take an oath to all of their future patients, that they will have meaningful experiences as medical students and embody the professional attributes to effectively care for the sick, alleviate suffering, promote health, inspire, discover, and educate. I think with all of you, I'm living up to my promise. So thank you, and I wish you a wonderful evening.
So first, we'd like to thank National AMSA, who awarded us with a local project grant. And we'd like to thank the Alumni Association, who not only helped us out financially, but also helped us reach out to the alumni. And we'd like to thank our student deans and the staff of Robert Wood Johnson, who gave us positive affirmation and support when we most needed it. And we're so grateful for our student volunteers here tonight, who are ensuring that everything runs smoothly, and of course, tonight's speakers. And we'd like to give a special shout out to the Med Talks Logistics Committee, who saw this event from beginning to the end.
I believe that the most infectious agent known to mankind is an idea. A great idea is contagious and penetrating. A great idea is full of power and permanence. A great idea takes root. It branches, grows, and when we give it life, it will ignite our thoughts, ourselves, our minds, like pillars of fire. Now, the beauty of an idea is that if you have an apple, and I have an apple too, and we exchange our apples, we're each still left with only one apple. But if you have an idea, and I have an idea, and we exchange ideas, now we each have two ideas. So what I'm saying is that in lieu of gift baskets tonight, we hope to leave you all with something a little more lasting, ideas. And it's for this reason that we'll also be recording our speakers so their ideas can be shared with an even wider audience locally and nationally. And to demonstrate to you the power that an idea can have, we'd like to trace for you the story of Med Talks.
So first, I'd like to show you a picture. This is a sketch that was done in the summer of 2012 as I was spacing out during a presentation about insurance benefits at an AMSA conference. And this logo, Med Talks, was a concept born from the musings that as medical students and professionals, we often live in a social bubble. But we know students with such grand passions, and we know alumni and faculty with great achievements to share. So could Med Talks be a way for us to break that social bubble, to connect with one another, and to not only be introspective about our motives in medicine, but also be outwardly focused on the community? But at that point, Med Talks was just a daydream, a wisp of an idea. And when I took it to Amanda, our vice president, and to Andrew, I expected them to say, an event like this, we don't have any money. It's going to be really hard to get the alumni to come. And we're second years, we have boards to study for. All of the roadblocks and obstacles that I had already set in front of the idea. But instead, they looked at me and said, "That's a great idea. Let's make this happen." And we did. In fact, we all did, because no one achieves anything alone. With the support and affirmation of many, this wisp of an idea was realized. So why are we all here tonight? We are here tonight because medicine is more than just an art of diagnosis. It engages our humanity. We're advocates, politicians, artists, scientists, singers, and dancers. And tonight you're going to hear ideas, passions, and innovations that will kindle something inside your mind and your heart. Students, you might find tonight that the alumni who are your seniors in medicine have become your peers in your shared passions. And alumni, you might find that clumsy medical student that shadows you is actually your partner that can help continue your legacy. So when you feel that spark tonight, I urge you to nurture it and to invest in it.
So this is one of the New York Times' best pictures of the year 2012. To take a photograph like this, where the light falls perfectly and the air bubbles add just the right amount of texture, photographers are trained to put themselves in the places of most potential. These are places where we can learn to capture the beauty in life, to harness creativity, and to transform the ordinary into the extraordinary. Our goal tonight is to prove to you that Robert Wood Johnson Medical School is undeniably one of those places of most potential. We are surrounded by faculty, alumni, and peers that can inspire us, challenge us, and above all else, at least for tonight, help us discover the Med Talks within our own lives. Thank you.